Damle, Educational Director of Maharashtra Mandi. Also, I thank Dr. Sopan Kangne Sir, Principal of Chandrasekhar Agashe College of Physical Education, for giving me an opportunity to host this session. I thank all the speakers and all the participants for being such an important part of today's program. Now, I would like to hand over the further program to Professor Yogesh Bodke Sir and Ms. Bhairavi Tharwar.
Thank you.
Thank you.
उनको बोल वीडियो नहीं दिख रहा ठीक से हो गया अनम्यूट वीडियो
Within a short time, Yogesh Bodke sir will take over. We have today's speaker, Dr. Bhushan Ganvir with us. Yes, Bhairavi madam, you are visible. You can start.
Yes, sir. Thank you, Priyanka ma'am. Good morning, everyone. I, Bhairavi Tharwar, on behalf of Maharashtra Mandal Chandrasekhar Agashe College of Physical Education, Pune, welcome you all the CARE National Conference on Rehabilitation of Sports Injuries, organized by Maharashtra Mandal Chandrasekhar Agashe College of Physical Education, Pune. Out of today's two technical sessions, the first session will be addressed by Dr. Bhushan Ganvir. Welcome, sir. Recently, he has been honored as a reviewer in KSSTA, European Journal of Sports Medicine. He is also an integral research team member with Dr. Raman Pugat at Curium Hospital in Barcelona, Spain. Beside basic and advanced arthroscopic surgeries of knee and shoulder, he is an expert in meniscal transplantation and cartilage implantation. He completed his MBBS in 2004 from NKP Sarga Medical Institute, Nagpur, and also has worked as an intern in the same institute. He has completed his DNB in orthopedics from Jahangir Hospital, Pune, with the topic of dissertation as Study of Integrity of Lateral Femoral Cortex in Interchantric Fracture. He has a fellowship in arthroscopy and sport medicine from August 2016 to March 2017 in Pune. Another fellowship is in arthroscopy and sports medicine from April 2017 to June 2017 in Barcelona, Spain. He had completed an on-site training program in August 2018 under the guidance of Professor Young Girl Lee, Professor Jasang Jin Shin, and Professor Jin Young Park. He has participated as faculty in basic knee arthroscopy cadaveric workshop in 2019 in D.Y. Patal Medical College, Kolhapur, KMASC arthroscopic course in 2019, Mumbai, and recent advances in orthopedics at IMA Pune in 2019. He has participated as delegate in second Pune knee course in 2012, third Pune knee course in 2013, shoulder conclave at the Nanath Mangeshkar Hospital, Pune in 2014, fourth Pune knee course in 2014, Pune shoulder course at Sancheti Hospital in 2014, fifth Pune knee course in 2015, and Pune shoulder course at Sancheti Hospital in 2015. He has work experience in orthopedics in Jahangir Hospital, Pune, as a lecturer from December 2011 to December 2012. Sir has worked as consultant from January 2013 to July 2014 at Nevasa, Ahmednagar. Sir has also worked as junior consultant in Columbia Asia Hospital, Pune from August 2014 to June 2016. He is currently working as a consultant arthroscopy and sports medicine in Lokmanya Group of Hospitals, Pune. He is a reviewer in American Journal of Sports Medicine and also in Orthopedic Journal of Sports Medicine. He is also an integral research member for Turin Hospital, Barcelona, Spain. He has a certificate of reviewer appreciation by Dr. Bruce Rader, who is MD, Editor-in-Chief of American Journal of Sports Medicine. Sir has performed super specialty arthroscopic surgeries at Addis Ababa, Ethiopia International Endoscopic Surgical Camp, organized by Lokmanya Group of Hospitals in collaboration with Rotary Club South, Pune, in February 2020. So, today in this CARE National Conference, Sir will be guiding us on the topic sports injuries management in kids and young athletes. Now, I would like to request Dr. Bhushan Gandhi to enlighten us with their knowledge. Please, sir.
Am I audible?
Yes, sir.
Yes, good morning, everyone. At the first, I would like to extend my warm wishes and heartiest congratulations to all the team members of Chandrasekhar Agashe College of Physical Education. Indeed, I take it as a matter of great honor and great privilege to be here and talking in front of you. Now, today's topic is very important: sports injury management in kids and young athletes. As we know, my PPT is visible, sorry.
Yes, sir. Yes, it's visible, sir.
Okay. Sorry for the technical glitch. Okay, as we are all aware, sports is an important part of the life, and sports is beneficial not only to maintain the physical and the mental health, but it's also important to maintain our life fit and healthy. In particularly children, it is important to it helps the children to increase the level of confidence, increase the level of social personality, and it also imbibes the values like working together in a team, and also builds up the values of self-discipline. And when we talk in the longer term, it helps to prevent the diseases like heart diseases, diabetes mellitus, and hypertension. But when we talk about the sports, the negative side or the bad news about the sports are the injuries. And I hope and I expect every sports women or men, they will suffer the injury in one or another time of their life. But the good news about the sports injury management is that most of the injuries can be predicted and they can be prevented with the understanding and proper treatment. Sports injuries can be categorized into the three types. Number one is the acute, number two is the overuse, and number three is the acute. Overuse injuries, they are due to the growing popularity of endurance sports. One causes acute. There are many or other sports person, and number two is a non-contact, which usually happens due to sudden fall due to loss of balance. When we talk about the classification, depending upon the site of tissue, it includes bone, cartilage, ligament, muscle, tendon, bursa, skin, and nerve. These are the few pictures of non-contact injury where you can see the sports person has suffered the injury maybe due to the skip or due to the loss of balance. These are the few injuries of contact injuries where it is obvious there is a collision between the two sports person resulting into the devastating injuries of the lower limb. This is another picture for the contact injury. So the causes for overuse sports injuries are number 2 is the incorrect technique, and number 3 is the incorrect equipment. Overuse injuries, then by and large, they are very difficult to diagnose, treat, and it's also very difficult to find the exact cause of the injury. And the treatment for overuse injuries is ideally a multifactorial approach. This is very important. We should know what are the terrible tools for the overuse injuries. Number 1 is too much. Number 2 is too soon. Number 3 is too fast. 4 is too hard, too often, and too little rest. These are the important aspects because in our daily practice, whenever we see any patient with a shoulder tendinitis or any tendinitis around the any joint of the body, these are the frequently asked questions about. So whenever your athlete or your coach, there, I mean, your team aspect keeping these injuries in the mind. In this chart, you can see there are few examples of acute injuries and the overuse injuries depending upon the soft tissue affected. Acute injuries of the bone mainly involves the fracture and the periosteal contusion, while overuse injuries of the fracture, periostitis, and apophysis. Acute injuries include frontal and endochondral fractures, and injuries of the arterial cartilage, they mainly include location and subject, while overuse injuries include and the osteoarthritis for the ligament mainly the spread grade D, while overuse include the inflammation of the acute injuries of the muscle mainly strain or tear, which can go to grade 3. It also includes contusion, cramp, acute compartment syndrome. Overuse injuries of the muscle include current compartment syndrome. Acute of the it can be a complete injuries of the tendinopathies. Acute injuries, traumatic bursitis, and include the bursitis, which can be either or it can be mechanical. Acute injuries for the nerve mainly include the neuropaxia and the minor nerve injury or irritation, while overuse injuries of the nerve include the entrapment and adverse neural tension. Acute injuries for the skin mainly laceration, abrasion, or puncture, which is one of the most common injury in our day-to-day sports, while overuse injuries for the skin include the blister and the callus. So these sort of injuries we must take into consideration, and we should keep it in mind whenever we talk or whenever we classify the injuries depending upon the sort of issue. The sports injuries, the main causes, either it can be intrinsic or extrinsic. The intrinsic causes for the sports injuries depends upon the player's age, joint instability, lack of muscle control, foot control and body coordination. It also depends upon the level of fitness, foot dominance, previous injuries, post-injury rehab, and the stress. Many times in my OPD, many athletes or coaches, they will always ask me, okay, doctor, what is the exact relation of age with the sports injuries? Because as we all know, our physiology and in particular the children less than 8 years of age, they have got the less coordination and less reaction time. So that's why the chances of injury, they are more in children, particularly if they are less than 8 years of age. And as well as the aging process and the physiological process due to aging, your reaction time, your agility, all goes on decreasing. So children less than 8 years of age and particularly athletes more than 30-35 years of age, they are more prone to injury because of all the physiological restriction. Another commonly asked question by the sport athletes to me during my OPD, so is there any age relation with the sports injuries? Yes, definitely. In particularly girls between the 10 to 14 years of age, they are more prone for injuries, particularly of the knees, because if you go by the normal physiological mechanism, females have the tendency to use more of the knee extensor as compared to the hip extensor. When we compare this physiology with the boys or males, they have the physiological response where they use knee and the hip extensor equally, while in females they use more of the knee extensor as compared to the hip extensor. That's why they put eccentric load or excessive load on the knee, and any sports that involves the loading or impact activities on the knee, there females have the more chances of injury. In particular, if you talk or if I see around the European sports culture, females will have more injuries of the knee, particularly anterior cruciate ligament injuries. So this is one of the important aspects we should keep it in mind and should consider whenever we are trying to find the sports injuries when it comes to intrinsic causes. When it comes to extrinsic causes for the sports injuries, it depends upon the standard and intensity of the training, playing surface condition, position plate, exercise load, quality of equipment like shoes and shin guards, and rules and falls. Playing surface, among all this, I think playing surface condition, particularly in our continent or country, is more important. It depends on the main importantly two conditions. What is the hardness of the surface and what is the friction between your shoes and the underlying playing surface. More the hard surface and more is the friction between the shoes and underlying surface are going to be the chances of injury. So that's why it is recommended to play on the grass or a soil rather than the hard surface like the wood or artificial floors. So this important intrinsic factor considered while finding out the cause of sports injuries. Then total care for exercising individual in sports medicine, it not only depends upon the athlete or coach, but it also depends upon the trainer, doctor, dietitian, psychologist, podiatrist, masseur, and physiotherapist. So it is a holistic approach. It cannot be isolated, complete training program by the athlete or your orthopedic surgeon. So it has to be a holistic approach, taking into consideration all the aspects and all the roles of all the figure what I have shown here. Then what is important? Injury prevention. The important steps are warm up, stretching, tapping and bracing, protective equipment, sport specific conditioning, appropriate training that we call periodization, adequate recovery, psychology, and nutrition. As we all know, warm up is very important. It can be sport specific. Ideal warm up of around 15 to 30 minutes is recommended because it effects last for 15 to 20 minutes. Then benefits of warm up are it increases blood flow to the muscles, it improves flexibility and helps to prevent the injuries, it helps to enhance the mechanical efficiency, and it increases the speed of the nerve impulses, thereby it helps to improve the agility. Second important part is the stretching. Again, it is a sport specific with a good technique. It can be static or dynamic. Holding time of around 15 to 20 seconds is advisable. Warm up before stretches is mandatory and try to make it pain-free as possible. Then tapping and bracing. As Madam has in my introduction, she has mentioned, I completed my basic fellowship training in Barcelona, Spain. So in Barcelona, where I work, I do a lot of tapping, what you call the kineso tapping, in particular for the shoulder, elbow, knee, as well as ankle. But when it comes to our country, it is not that common. But with the more interest in the professional sports, I think this culture is also increasing with the more awareness about the physiology of our joints. So tapping and bracing that also helps for the prevention of the ankle, knee, or shoulder or elbow injuries. Rehabilitation, it avoids the recurrence. And braces can be useful not only in the ACL but also the collateral and the meniscus injuries. And orthotics can also help for the prevention and the recurrence of the injuries. Then protective equipment like helmets, mouth guards, shin pads, knee pads, elbow pads, and groin protectors can further aid in preventing the sports injuries. Then this is something what I'll be more interested to talk about, periodization. It is relatively newer concept. It involves the planning of training programs, taking into consideration the training intensity, volume, and the frequency. It basically requires breaking up of training program into the phases. It is not a perfect science, but good program can be designed depending upon the sports science knowledge and experience on the coach and the trainer. Why periodization is very important? Because it helps and enhances the performance. It follows a routine for training. It avoids overtraining. Attaining the optimal performance at the desired level, what you call the peak, is important. It helps for the active recovery, and it also trains all the aspect of biometric abilities, which I'll be talking in the next few slides. These are the few graphs of periodization where you can see it is mainly divided into the preparatory period, transition period, competition period, and transition period. I think your athlete or trainer probably will help you and train you according to these phases. These are the few more slides for the periodization plan. This is the tricycle plan for the periodization, which I believe. This is where I am more interested to talk about the biometric abilities, because here the age and the what level of activities we are supposed to do. So I think this chart will be of very help for all of us. When you talk about the coordination, for the age of 6 to 12 years, basic level of coordination activities are recommended. For 12 to 16 years of age, complex coordination, and for sports athletes more than 16 years of age, perfection is something that is advisable. When it comes to flexibility, overall flexibility is recommended for 16 to 14 years of age, but for 14 to 17 years of age, specific, and for 18 years of more than 18 years of age, we just need to maintain the flexibility exercises. For agility, at the age of 10 to 17 years, maximum focus is given, and for 18 plus, we just need to maintain. Strength, we start at the age of 13, 15, more maximum strength look after. Sorry. For endurance, we start at the age of 8 years, and for 14 years, we concentrate more on the sprinting and anaerobic. Then comes the recovery. So micro damage occurs to the musculoskeletal system post exercise. Recovery of this damaged tissue is essential to attain the peak performance in the next competition. Psychological recovery, like motivation and stress handling, is also the important aspect. So recovery, number one is the immediate post recovery. Number two is a long recovery. Post game recovery, advice, warm down, or they ask me for how much goes on exact preparative. If you are around 15 to 20 minutes, you should do the warm down or cool down of 15 to 20 minutes. Concentrate on stretching off gluteal muscles and holding time with the meditations, ice baths, other massages, and massage as well. Long-term recovery perspective, yoga, cross training, other sports and swimming also recommended. Then sport-specific conditioning, where we concentrate more on the strengthening of the muscle group required for the sports. Strengthening of opposite muscle group to avoid the muscle imbalance. Emphasis on the gym program, especially in the first phase of periodization, and tasks can start gymming at the age of 13 years. Endurance training. Endurance is basically where we concentrate on the exercises that helps to increase your heart rate as well as the respiratory rate. These are research has proved that athletes with a good endurance have very good reaction time and have the good physical and the mental agility. Good endurance will prevent the early fatigue and thus also prevent the injuries. Important nutrition provides energy for the sports. Type of nutrition, it depends upon the structure of the training. Ideally, should avoid the fats and oily foods because they reduce the agility and increases the reaction time, which can affect the peak performance of the sports person. Correct nutrition will help in developing the muscle bulk and also help in developing your better reaction time, which is essential for the injury. Then, which is only neglected, so is during the exercise. So it's important and mandatory to maintain the good hydration during, before, during, and after exercise as well. Adequate water is essential to maintain the blood volume as well as cardiovascular function, and it also helps to regulate the body temperature. Then, important aspects: if somebody has sports injuries, then how to guide about. Important 8 are protect, rest, ice, and in the first aid, the important aspect is the protect. Important thing is move the athlete to a safe or the shaded area, have the correct lifting technique or support the affected area. Suppose if the patient or the sports person has sustained injury to the neck, then proper technique, particular in the neck injury, is very important, because if you don't practice the correct lifting technique, so that can cause the more serious neurological damage. And in case if it's not possible to move the athlete, then clear the area. Second important is the rest. Stop any movements of, because that will not only aggravate the injury, it will also give pain to the patient or the sports person. Continuing movement will lead to the bleeding and the swelling. Provide sling in case of shoulder, elbow injuries, and can give the crutch or walker in case of lower limb injuries. Ice is one of the important aspects that we usually advise to our patients or sports person, because this ice application, it leads to reduction in the pain and it also decreases the bleeding and thus reduces the swelling. Use ice packs, crushed ice, and cooling sprays. Apply ice 10 to 15 minutes every 2 hours for initial 24 to 48 hours, depending upon the severity of injury. Crushed ice or ice cubes in the plastic bags is very economical and very convenient in our setting. Then comes here the compression. Compression helps in reducing costs, not to lose. Bandaging should start to the also helps to reduce the swelling. Affected part should be kept above the heart level and can use the sling for upper limb and resting the lower limb on the chair. Then referral. Refer the patient to an expert. This is most important suggestion, I would say, because in our setting, suppose if somebody has countered the injury, so many patients, they will apply some hot applications, some massage, which is not really advised, and many people, they will just try to Google and they will find out what needs to be done. But I think this is something we all of us should refrain. If you think this injury is severe, or even if it is not severe, do the primary treatment, do the first aid, and kindly refer the patient to an expert. Do not or advise or diagnose if you are not sure, and follow up the patient to know if the opinion of the medical professional is important. Then this is what I was talking about. What are the do nots? We should not apply the heat, should not apply the oil, should refrain from any moderate or intense activity, should not do any vigorous massage. And of course, this is the most commonly question which asked to me in my OPD about the alcohol, which is not advised. Then let us consider about the rehab in the sports. In the initial phases of rehab, we advise the minimal activity. And in the latter half, once the recovery is complete, we advise the full functional activity. And these are the pillars of recovery, where we concentrate more on the functional activity progression, motor control and skill acquisition, balance and proprioception, muscle strength, power and endurance, muscle flexibility and joint stability, tissue healing constraints, and pre-injury health status. So important parameters are diagnosis, acute care management, surgical intervention if needed, and rehabilitation skills. So successful rehab requires education of the athlete, family, and coach, goal settings, good social and support system, and mental training. So what important factors we really consider for the rehab are age of the patient, which we already discussed, the functional requirement of the individual, nature of the sports, conservative and accelerated rehab, pre-injury status like cardiorespiratory status, and associated multi-ligament in the MCL or meniscus. In the principles, know if the rehab is inadequate, may be incapable with the pre-standard and usually injury another part of the body. Usually believe involves phases of patient that we look into. In the initial phases of rehab, where the function level is poor, we mainly concentrate on that is raised high supplication, crab bandage and elevation, electrotherapeutic modalities, stretches and range of movement exercises, and isometric exercises. In the intermediate stage of rehab, where the function level is good, we concentrate more on the stretches and range of movement exercises rather than electrotherapy. We concentrate also on the proprioception and stability programs. In the advanced stage of rehab, where the functional level is good, we start working on strength, especially the power, proprioception, stability program, and the functional activity. And in the in the stage where sports person want to return to the sport and the function level is good, we continue all the strength, power, and the proprioception and the flexibility workout. So different aspects of the rehab are the flexibility, strength, endurance, core stability, motor control, proprioception, balance and coordination, agility and plyometrics, and biomechanics. So when we talk about the rehab, the individualized approach is more important, because rehab protocol is not a fixed line, or there are no fixed guidelines, but the treatment plan we specify for the rehab depends upon the age, gender, past similar injury or history, sports, individual strength and weakness, and all this is essential for ideal treatment progression. So compliance is very important, because if athlete overdo the rehab, then what I discussed earlier may be prone for the recurrent injuries. So should maintain the diary for his rehab, should be regular monitor under the guidance of trainer or athlete, and rehab should be more exciting and should be modifying. So what are the take-home message for return to play criteria? Number one, we should establish the diagnosis. We should know what are the demands of the sports, what are the effects, what effect does injury have on the meeting of the demands, how effective has the treatment in reducing the physical limitation in injury and preparing to meet the functional requirement, is the protective equipment available, is it effective, and how does it helps in improve the performances, what is the risk of further injury, does the athlete want to play, and does the athlete and guardian understand and accept the risk to play. So I think these are the important key factors. So I would like to request Mr. Madik and all the organizing committee make this session now more interactive, and I think I'll be of some help if I can share my knowledge with all of you. Thank you.
Thank you, Dr. Bhushan Ganvi, sir. So we have some questions in the chat box that I will share with you. Okay, can we start, sir? Some questions are there.
Please.
So first question is, what are the benefits of kinesiological taping? Is it really beneficial for a sports person to use KT tape?
First of all, yes, exactly. But what I, as a surgeon or as a sports medicine physician, we should know what is the cause. I mean, suppose many times in our Indian setting, I get a lot of patients, or when I operate in the Europe or Barcelona, we do get a lot of patients for patellar tendinitis or quadricep tendinitis. Again, we should know what is the cause. Kinesio taping is something that will treat only the effect, that does not treat the cause. First of all, if the cause of patellar tendinitis is due to the abnormal patellar tracking, due to the VMO weakness, or if it is due to the rectus femoris tightness, the first important thing is to correct the VMO strengthening, to be the lateral patellar release, or the concentrate more on the patellar glides and active stretcher. And even after that, or rectifying all these factors, still if you think patient has some patellar tendinitis, and then definitely kinesio taping will definitely help. Okay, but identifying the primary cause is more important.
Yes, sir. Thank you, sir. Questions are there more. What is the difference between shin splints and stress fracture? Difference
Yes,
between shin splints and stress fracture.
see,
And how should we take care of that?
yes, exactly. Particular, I think in one of my slides, I mentioned about the importance of the surface where we are playing, right? If we subject our sports person directly to the impact activities without proper warm up and stretching, and in particular on the hard surface, I mean the surface which is hard, and if there is too much of friction between your shoes and the hard surface, that puts a eccentric load on the proximal aspect of the tibia. So, and because of that eccentric loading, when we talk about the physiological process, there are two continuous processes, what we call the osteoblast and osteoclastic process. So during this process, due to eccentric loading on the tibia, the osteoclastic process, it takes over the osteoblastic process, and that particular point can act as a focal point for the fracture. So in this case, the first important thing, even after taking the rest for 48 to 72 hours, the patient or the person will complain of the pain on the localized area. And even after taking the painkillers or taking the best possible primary care, if you have the pain for 3 to 6 weeks, that is the time you should consult your physician. And the best modality to diagnose is the clinical evaluation, and if required, get the MRI. So that will definitely help, sir.
Yes, sir. Thank you. Basically, we should avoid playing on the hard surface or use.
Yeah, that is a take-home message. Exactly.
Yes. And good shoes will also help, right, sir?
Yes. Good shoes, along with we must take into account what is the hardness of the surface. Okay? Yes, that is something we should take into consideration.
Sir, some Nikhil Pawar from Pune has asked about the ACL tear. Will it recover, or is there a modern technique used by doctors to make ACL as it was original?
Yes, I think that is a very good question. As far as ACL reconstruction is concerned, that depends upon the what sort of graft you are using. When I operate in Europe and Barcelona, I usually use the BTP, that is bone patellar bone tendon, and you will be surprised or you'll be happy to know most of my operated patients in Europe and who are playing for Barcelona, AC Milan, Real Madrid, they have started playing the international level of sports in 4 to 5 months. Because it not only depends on the surgery or the type of graft that we use, but it also depends upon the rehab and intensity of the rehab and the guidance. In our setting, probably that is one of the important or aspect that we really miss. If we do the surgery, the first thing the question will ask, hey, doctor, when can I start my cooking? When can I start my office? Other than asking, can I start my sports activities? And it's a two-way affair. If the surgery is important, if I say 50% is surgery, the next 50% is the rehab. In surgery, usually them to the normal sports activity in 4 to 6 months, provided if they do the good physiotherapy, because any patient which I get from the CRPF or NDRF in India, they will start their sports activities like running, jumping, all the impact activities probably in the 4 to 5 months. It does not depend only on the surgery or the type of the graft or where I operate. It also depends upon the physiotherapy. Yes, But in my setup, I usually start, or they can get back to their normal sports activities in 4 to 6 months.
Yes, sir. Yes, sir. So basically, rehabilitation process should be scientific and it should be sound.
It
Then
should be
only
customized.
yes. Then only can a player return to sports activities.
Exactly.
Sir, so when we do reconstruction, as you said that suppose there is a complete tear of an ACL, and we do reconstruction, we take it from somewhere else. So what about that part of the body? Does it get weakened or like that?
No. That is just a hypothesis. That is not the thesis. Because what you use the hamstring, and we take only the 5 to 10% of the hamstring, what we call the tendon. And if you do good amount of stretches and strengthening, it hardly matters. It does not. That is the hypothesis, and that is a misconception. That is not the thesis.
Yes, yes. Thank you very much. One more question is regarding bunion toe. So most of the our sports person, wear tight shoes, and because of that, they get that toe, bunion toe. So how it is used, how to treat it, or what can be done for that?
I did not get your question. Can you please repeat?
Just a minute, sir. Sir, one of the participant has asked about bunion toe.
Okay.
Sir, so how to treat that or how to tackle that injury? Because
Yeah.
most of the sports person wear tight shoes and they work on the hard surface as well. So is there any surgical treatment for that?
First of all, I think you have almost given the answer for your question. You have said about the tight shoe, so I think that should be avoided. Second important thing, if you think because of wearing the tight shoes or playing on the hard surface, if you think there is a cause, I mean, it should be verified clinically by the sports physician, then that should be a simple important thing. We talk about, so it's the first starts meningeal joint. So
Yes,
important, we always take into consider about the what are there in inflammatory cause like uric acid, or is it just a mechanical? To categorize, is it just a traumatic, is it inflammatory, or some other causes? So I think if it's related mechanically to the sports shoes, so I think that should be avoided. We need to find out it is flexible or the resistant deformity. If it's a flexible deformity, definitely we can correct it with the footwear modification, using the toe spacer in between the shoes. But if you're trying all metal modalities, still if it's a recurrent deformity, and definitely yes, we can get it corrected by the surgeon. It's a thorough clinical and radiological approach.
Yes, sir. Thank you very much, sir. Sir, Kostov has asked a question regarding the warm-up sessions. So what should be the proper warm-up session? Because he has given reference that many different books or the agencies have given different steps of warm-up. So what should be the proper warm-up in your?
See, that's why I say, okay, there are no fixed lines or protocol. It depends upon what is the age and what sports you are actually targeting. So warm up of around 15 to 20 minutes is, I think, is essential. And when you are talking about the warm up, it's not only the warm up, the cool down is also equally important. So I think you can just get it done under the guidance of your trainer or athlete. Probably they will be the best person. But 15 to 20 minutes of warm up, I think, is more than essential and important.
One interesting question from Amit Lahekar. Some athletes from foreign countries like Ethiopia or else or European countries, they quickly recover from their injuries, wherein our Indian athletes, they take a long time for recovery. What is the difference between them?
No, again, I think that's I don't believe in that. That is a misconception. See, when we talk about the physiology, no matter what surgery you give, what I mentioned earlier, if I say 50% is my surgery, then 50% has to be the physiotherapy. Okay, so probably is the physiotherapy after surgery that makes a difference. If you do the good physiotherapy, definitely you will get back to your normal routine activities at the earliest. But if you don't do, then probably 6 or 8 months, probably it may take even the more. So, but as far as your, if he's saying recovery in terms of infection in Ethiopia, because where did the super specialty surgeries in Addis Ababa, I would say yes, immune power of these people is definitely better than other Asian or European continent. In terms of recovery, when we take into the infection perspective, is definitely better. But when it comes to sports medicine or sports physiotherapy, is not the straight jacket formula. You will have to put the heart and soul effort.
Yes, sir. One more question, sir. So one of our the participant is asking about the stretching type after injury. Suppose we injure our muscle or tendon. After injury, there is a formation of scar tissue between this
Exactly.
your tendon and muscle. So how to avoid it, or what type of stretching should be done? So can you elaborate on that scar tissue type? Means they are reading about scar tissue. So what is it and how to avoid it?
I think that is one of the very, very interesting and very important question. See, whenever we talk about any injury to the muscle tendon, the healing is going to occur through the fibrosis. And when we do the stretching, our basic aim is the alignment of that fibrosis in the normal anatomical pattern. And in the initial phases, suppose if the patient has an ankle injury or knee injury in the initial stages, we usually advise only for the isometric in the first week or 10 days. Once the inflammation has come down, then start the stretching under the guidance of physiotherapy, and you can start the stretching practically 10 days 2 weeks after the injury once the inflammation settled down, but initial 7 to 10 days or preferably 10 days to 2 weeks. If the inflammation is still there, it is not really advisable, but for the initial week or 10 days, concentrate more on the isomatics, and once the inflammation has come down, once the pain has come down, then gradually start the stretching, sir.
Yes, sir. Thank you. Yes, Prabhu sir
Yes,
is
sir.
asking a question.
Sir, a lot of our players, they get injured. They like an ACL tear or a overstretching of the ligaments and all, and they're very scared to get them operated. So what would you suggest them? This is the first one. And the second one is, should they go for operations or surgeries, or they can rely on physiotherapy or any other healing technique?
No. First of all, your question is very important. You said what we should do if they encounter the ACL injury. I think if they are scared, I mean, anybody will get scared. If forget about the ligament or even the laceration or bruise, that's a normal physiological response. So I think the first important part is the counseling. We should counsel, and in my OPD, I usually show them the other patient who underwent the surgery and come back to the normal life. So I think counseling, giving time to the patient and making them understand the physiology from long-term perspective is important. And it's not only about the getting back to the sports. Okay, if you don't do the ACL surgery, it will have the repercussion on the long term. Like you can have the meniscal injury and early arthritis progression. So when I advise the surgery, and provided if it's subjectively and objectively unstable and MRI confirm the same thing. So basic purpose of doing the ACL reconstruction is to get him back to their normal life. That is the primary objective. And second important objective is to prevent the secondary complication like premature progression of the arthritis and the meniscal or the meniscal root injuries. And as far as when the ACL tear is, once we diagnose there is ACL tear, and there is a subjective instability and with the objective laxity, and it also depends upon what are the objectives of the person. If the person says, sir, I want to get back to my normal life, I want to get back to my sports activities, surgery is the only solution. And second important, if patient says, no doctor, I don't want to run, I don't want to get involved myself in any sports activities, probably few years down the line or few decades down the line, suppose 10 to 15 years down the line when I was studying, probably doctor will say, okay, if you are ready to modify lifestyle, don't do anything. But in present era, as a surgeon, I must counsel, probably if you don't want to run, if you don't want to involve in the sports activities, and if you are a young, less than 45, 50, still I would like to advise a surgery, keeping in mind the secondary repercussion which patient is going to have in the next couple of years. Okay, so as if the ACL is tear, I don't know. I mean, I don't advise any other modalities, depending upon what is the age of the patient, what is the function requirement. Thank you.
Yeah, thank you, sir. Sir, one more question. What is the future of treatment in India? Means sports-related injuries treatment. Future, do you think there will be a good technologies wherein the athlete will recover very fast? Is it there available in India, or in future there will be ability of such technologies?
Yes. Yeah, exactly. I mean, as you already know, I'm working in Spain. I am one of the operating consultant in Pune Hospital, Barcelona. So the technique which I use for the reconstruction of the ligaments, let it be of shoulder or knee, I'm using the same technique as far as ligament reconstruction or meniscus repair is concerned. And as far as future of sports medicine in India is concerned, I'm one of the international research member for stem cell in Germany, Spain, as well as America. So I have started in our Pune, the same stem cell like plaquetous plasma, autologous chondrocyte, serum injection, and autologous chondrocyte implantation technique, mosaic-plasty, which will have the better functional outcome, and that will also prevent the progression of the arthritis. So already these are the new technique, and which we commonly do in the Europe, which I commonly do in the Europe, which I have already started in India. So I think future is going to be good. So till now, we were opting the mechanical solution for the biological problem. Suppose if the patient has a cartilage injury, right? What we used to do, inject a steroid, or ask the patient to modify the lifestyle, and over the period of time, patient will have the arthritis and they undergo the knee replacement. Means ultimately for the biological problem, we are opting for the mechanical solution. So in the last couple of years, I've started giving this stem cell. I mean, I'm not advocating, just I'm giving it because of the scientific, and it is what we are doing in the Spain and Germany for more than decades. So the now future is going to be to opt for the biological solution for the biological problem rather than the mechanical. I think that is the key, and I think that is a very good question.
Yeah, that was great answer, sir. Well, thank you very much. So I hope there is a good future of sports person like us who get injured, and I hope they will get recover very fast using your techniques, new technologies given by the Lokmanya Hospital. Well, Prabhu sir is asking one more question.
So I would like to ask, a lot of the international players are getting injured, even if they are they have a lot of things, rehabilitation, preventive measures, everything. Still, they're getting injured. But my question is, how do they come back to sports so early than the general like players
Population.
or general population?
Yeah, first of all, because they follow the holistic approach. Even if they sustain the injury, there is I mean, what I shown in my diagram, it's a team effort, right? You need to have your dietitian, you need to have your psychiatrist, physiotherapist, orthopedic surgeon. So it's a team, holistic team. They will assess what is the clinical problem, and once that problem is addressed, so all the team like physiotherapist, your orthopedic surgeon, your trainer, they come together, and being there the professionals, the intensity of the rehab is definitely is better than, or it cannot be compared even with the general population. So I think it also comes from within. Okay, I want to just get back to my normal activities, and I just want to go back to my sports activities. So the effort which is required from the orthopedic surgeon, your physiotherapist or trainer, but that amount of it has to come from your sports person as well. So it is a combination of both. So holistic treatment under the guidance of your all the team member and with the proper clinical approach and diagnosis is the key. Getting back to your normal life at the earliest. I think that is the key between the general population and these sports persons.
Thank you, sir.
Yeah, thank you very much, sir. It was great to have you as a session, resource person for this session. Over to Yogesh Bodke, sir.
Thank you, sir. After this amazing session with Dr. Bhushan Ganvi, sir, I am sure that all the participants must have gained a lot of knowledge. Today, sir has guided us on many topics. He told us about the classification and the types of sports injuries, their causes. Sir talked about the terrible tools which cause overuse injuries. Sir also guided us about the prevention of sports injuries and how warm-up and stretching and also the endurance training are important. Today, Sir has also introduced many of us to the relatively new concept of periodization. He guided us on how first aid is important. Then he talked about the pillars, principles, phases, and aspects of rehabilitation. He has shared a valuable information about ACL tear and its rehabilitation. Hereby, I would like to thank Dr. Bhushan Ganvi sir on behalf of Maharashtra Mandal Chandrasekhar Agashe College of Physical Education, Pune, for his valuable guidance and enlightening words on today's topic, sports injuries, management in kids and young athletes, and for guiding our participants by answering their questions. Also, I thank Dr. Sopan Kangne sir, Principal of Maharashtra Mandal Chandrasekhar Agashe College of Physical Education, for giving me an opportunity to host this session. Now, I would like to hand over a further program to Ms. Andrea Francis and Professor Shraddha Naik. Thank you.
Bhushan sir, thank you very much.
Thank you very much. I appreciate that. Thank you. It's a pleasure. Thank you, sir.
Andrea, you can start.
Yes, sir. Just a moment.
Good morning. I'm Andrea, student of Chandrasekhar Agashe College. My colleagues have each introduced our special guests here today, and I have been given the privilege to introduce and welcome a very special personality amongst us. Please put your hands together for Dr. Radhika Patal. Any amount of time given to me is less to talk about Dr. Radhika Patal's life and achievements. She trained as a physiotherapist from Sancheti Hospital in Pune. She earned her PhD doctorate in geriatrics and disease prevention from the University of Tampere in Finland. She has 20 years of experience in clinical physiotherapy and research in Finland and India. She has authored several highly impacted international research papers, popularized articles, and authored a book titled Exercise in Older Women, Effects on Falls, Function, Fear, and Finances. Based on her doctoral studies, her areas of expertise includes A, physical functioning and falls prevention in older persons, and B, physical activities and research prescriptions. She currently heads the Department of Physiotherapy at Jangir Hospital since 2017. I request Dr. Patal to please take over this webinar and impart to us her experiences and knowledge in a few words.
Thank you, Andrea, for your very kind introduction. And I must say that I am very thankful, and it is a privilege for me to talk at this esteemed forum.
Most
and
welcome, ma'am.
Sorry?
You're most welcome, ma'am.
Yeah. Okay, thank you. So I must also say before I begin that it is a very proud moment for me to acknowledge that we have such a wonderful college as Chandrasekhar Agashe College of Physical Education, and it is its home is Pune, which is my hometown. It is very important to have such an institution, students and different professionals that might have joined this session today. And I just like to start sharing my screen now. So I hope that if someone can tell me that this is being seen.
Yeah.
Yes, ma'am.
Okay, great.
Ma'am, could you start the presentation, because we can just, yes.
Okay. So I will be talking about exercise prescription for senior citizens or older adults and its effects on physical functioning. Now, many of you might have thought that why such a topic in a sports conference. But I will show you very soon that because the population is aging in general, you might have come across data. Most of our population is now above the age of 40 and 45. many of us are almost that age, and whether anything at all is common to all of us on this forum today, it is the fact that we are all aging, and sooner or later we are all going to be older adults or senior citizens. And therefore it is very, very important that we do talk about how to preserve physical functioning in older people, how to prescribe exercise for them, and also talk about its safety aspects. So, giving you a general overview of the topic that I'm going to discuss today, of course, we'll talk about some basic with what are the different health issues that are faced by older persons, what is physical fitness, what does that mean in older people, why it impacts physical functioning so much, what are the components of physical fitness, and of course then how to design a suitable exercise program and how exercise can help different issues that are faced by older people. Now, very quickly, I will walk you through the typical changes that happen with advancing age. Now, all the systems in our body as we age undergo a lot of change. Now, these changes may not always be negative, but at least some areas you might find that, for example, your muscle function may reduce, wherein powers your endurance may reduce, you may become more susceptible to getting fatigued very early. Of course, flexibility also changes as you age. Balance and mobility may reduce. Your motor reaction time may increase when you react, or your may important the function and be with blood pressure changes occur. The how we extract oxygen from our lungs or from the air, that changes. And then of course body fluid regulation also changes. So these are all the cardiovascular issues or changes that happen. In your lungs also, gas exchange that happens, the intake of oxygen and giving out carbon dioxide, that exchange may change over your age. Physical functioning capacities also may undergo a lot of changes. Like for example, your ability to do certain things, how well you are able to endure certain activities in your daily life, that may also change. In body composition, you might find that the percentage of fat increases slowly. These all changes happen naturally and happen to everybody. So therefore, fat percentage is always rising compared to what it was during your childhood and when one is a young adult. Also, your muscle mass and size reduces. So these things happen also naturally. There are other metabolic changes in your endocrine function. For example, all your hormonal metabolism that occurs in your body, that also undergoes a lot of change as you age. But we must remember that in spite of all these things, health in older age is not random. So you might find that an 80-year-old person is very, very active, whereas a 60-year-old person may have a lot of diseases and different problems in their life. So what is it that makes us different people age differently? Now, of course, the main building block for the way we age is your genetic inheritance. So you will probably get some genes from your parents, and that will determine how long you are going to live and how you are going to age. And the second part of it is our own personality. So who we are, what we do, what are our habits, how we lead our life, that is also equally important. Our health behaviors become extremely important, how fit we keep ourselves, whether we exercise regularly, what kind of diet we follow, that type of health behavior becomes also extremely important and has a direct impact on the way we age. Another thing that is important is our lifestyle or our lifetime, the place where we live. For instance, a person living in a crowded area where there is a lot of pollution in a big city will probably age a lot different than a person who lives in clean air and in a village where everything, the food and everything is prepared freshly. So therefore, where we live, what our lifestyle is, whether we are exposed to a lot of carcinogens or working in factories where there are a lot of harmful chemicals that we inhale. So where we live, where we work also has a great impact. And the last but not the least, our access to health care. So how well we have maintained our health, whether we take our medicines on time, whether we have a doctor and other facilities, medical facilities available to us, that also has an impact on how we age. Now, if you look at this graph, we are going to talk about physical function. Now, in a nutshell, physical function is basically your ability to do your everyday activities in daily life. Now, if I assume that everyone here is about under the age of 50 possibly, and there are a lot of students here on this forum, so we are all young right now, so we never really think about difficulties in physical functioning. But imagine a time where you might have difficulty walking from your home to your neighborhood shop, for example. You might have difficulty climbing stairs. You might have a lot of problems picking up heavy objects, or playing or performing your regular physical activity or sports that you are currently engaged in. So therefore, these all activities which you want to do over your regular day-to-day life is called physical functioning. Now, if you look at this graph, you have functional capacity on one side and then age on the other side. So you will see that one always reaches the peak functional capacity up to 20 years of age, and your early life is spent in growth and development, and we develop all these skills. We initially, as a child, we learn to walk, we learn to run, we learn to jump, and then slowly we pick up more and more skills, and your peak functional capacity is usually reached around the age of 20 to 25. Now, after that, during adulthood, it depends on how well we preserve our physical fitness, how active we are, how athletic we are, and how much exercise we do, and therefore how much we preserve this fitness that we have gained in the early years of our life. During old age, we call old age generally as above 65 years of age. But then when you reach that age, the whole bodily systems shift towards preserving this functional ability. So it's no longer physical fitness, but more towards functional ability. And then you will see that there is a huge gap over here. And that is where you will have either a healthy older person or a not very healthy older person, because of the way that their health behaviors and work related and other issues have taken place. So your functional ability may show a wide range of differences in older age compared to when you were younger. Now, what are the typical issues that older people face? So a lot of 65 plus year olds will tell you that I have high blood pressure, or I have deranged lipid profile, or I have backaches or some other spinal issues. Many people now, we are the diabetes capital of the world, India. And therefore, every other person in India, especially in that age group, has type 2 diabetes. People may suffer from joint arthritis. Of course, osteoporosis is also equally important and a serious health issue. And apart from all these physical issues, people also suffer from mental health problems and depression. So typically you will find that an older person complains of backache, they may have joint pains, they cannot sleep well at night, they all have digestion issues, because every other older person I talk to will say that they eat this churran and that isabgol and whatnot. And then people may complain of sciatica. They have swollen feet because they have problems with their blood circulation and blood pressure. Then problems with acidity, and of course then feelings of loneliness, and of course symptoms of depression. Now, if you look at the top 15 causes of years lived with disability, this is a study published by the Lancet in 2018, and you will see that the top 15 causes you will have exactly the things that I just mentioned. So there is low back pain at the top of the list, that maximum people with disability first, the causes are low back pain. Then there is depression there is neck pain immediately there. You have diabetes at number 7. You have COPD, which is obstructive lung disease. At number 8, you have anxiety disorders. At number 10, you have other musculoskeletal, knee pain, etc. Issues. And at number 12, there is falls. So falls, I don't mean in a road or injury like that, but basically down and getting and a disability. So falls makes it within the top 15. Also, there is osteoarthritis, and then all these issues I have just discussed, and these are the major things that affect older people and society in general. If you look at activities of daily living, this is data from India, and you will see that when you are between the age of 18 to 30 years of age, hardly anybody, less than 10% or maybe less than 5% people will say that they have difficulties doing your everyday work or household activities. But this figure drastically rises, especially after the age of 60 and 65. And suddenly the graph shoots up, so that you will see that almost 60% of women especially will report severe difficulty. This is only the ones who say severe. There are a lot more people who complain of moderate and mild difficulties while doing regular everyday household activities like cooking or bathing or dressing and so on. So why is this, and whether we can do something about this? Now, another thing that I mentioned earlier, which is my pet topic, and that is why I have included a couple of slides about it. So, falls in older people. So, decline in all this physical functioning, not able to do, not able to walk, muscle strength is reducing. There is loss of independence and poor quality of life. All this basically predisposes an older person to falling. Approximately 1 in 3 people over the age of 65. Now, please note that this is a huge figure. So 1 in 3 persons report that they have fallen in the last 1 year in their lifetime. So, and if you go ask this question to those over 80 years of age, almost 1 in 2 persons, so every other person will say that they have had a fall in the last 1 year. Now, if so many people are falling, 1/5 of these require medical attention. Serious injuries happen. 15% of the all the falls will result in serious injuries, and of course, 5% result in fractures. Now, 5% in the entire elderly population is a huge amount of fractures that happen every single year and every single day as well. Now, all these falls, they also contribute to huge cost to healthcare systems worldwide, not only India. But in spite of all this, I still want to tell you that falls are not part of the normal aging process. So you shouldn't just brush it off saying that, "Arey, umar ho gayi to girna padna to usual hai." That is not part of the normal aging process. Now, what is the role of exercise? Now, I've talked about a lot of disease, a lot of disability, falls, and we come to the part where how we can prevent and treat this. Now, this table in a nutshell will show you the evidence or the research that has proven which conditions exercise can prevent and reduce. So wherever you see a plus sign, there is ample A grade evidence that exercise can either prevent or reduce that particular disease. So you will see that almost everything, cardiovascular diseases. So in putting it in plain language, you will have less risk of having a heart attack at the age of 40 or 50 if you are regularly exercising. Similarly, developing high blood pressure, developing a deranged lipid profile, diabetes, very clear evidence that exercise can prevent and reduce. So if can prevent, or if you already have it, it can reduce the effect of type 2 diabetes. Osteoarthritis, there is evidence. Osteoporosis, there is evidence. Low back pain can be reduced. Of course, other things like all including cancer, exercise can prevent many types of cancer in people. It can have a very good effect on depression, anxiety, and also there is ample evidence that it can reduce and prevent falls. So now, if I've talked that exercise can be beneficial, let us have a look at what is physical fitness and what is physical activity. So basically, physical activity is all the physical type of work that you perform throughout your day. So whenever you're on the go, you're walking, you are doing your everyday things, that is when you can say that you are physically active. Physical fitness follows through physical activity when you exercise and you gain certain amount of endurance and muscular fitness. That is when you are called physically fit, and all these together contribute to health. Now let us take a little look at what are the components of physical fitness. Very commonly we all talk about aerobic, or this is where your cardiorespiratory system is involved. Your heart and your lungs primarily contribute to this type of physical fitness. The second very important type is your motor fitness, which involves the control of your movements. So movement control involves also endurance as well as the health of your muscles. So both things plus balance are involved in controlling of your movements. The third very important aspect is musculoskeletal fitness, so which means the strength of your muscles as well as your bones, ligaments, joints, etc. So that goes for musculoskeletal fitness. Another important aspect of physical fitness is body configuration. By this we mean what is the amount of fat in your body or muscle percentage in your body, or how much fluid you have in your body, and so on. So body configuration, and of course how well your metabolism or your nutrient exchange is happening. So whatever food you eat, this is a small example, whatever food you eat, how well it is taken up by your cells, and energy release so that you can use it. We will concentrate more on the top three aspects of physical fitness right now in this talk. So let us first talk about aerobic or endurance fitness. So there are very serious health risks of being having poor aerobic fitness. You are very susceptible, as I already told you, to heart and circulatory diseases. So having high blood pressure slowly creeps up on us. We gain weight, we reduce our aerobic fitness, and therefore slowly you find that your blood pressure rises, and of course puts you at great risk for type 2 diabetes. So what are the types of aerobic activity that you can do? This is a very general slide where we talk about walking, because in India, I seem to see that walking seems to be like the national sport over here. So if you ask anybody, especially in their adulthood or in the late stages of their adulthood, if you ask them if they do any sort of physical exercise, and this is basically what everybody says, that they walk. But what does it mean that whether how much you are walking, whether it is enough or it is not? So there is a general guideline. So if you're taking about 5,000 steps in a day, throughout the day, it is basically insufficient for any sort of physiological effect to happen on your aerobic fitness. If you step it up a little bit, add 30 minutes of a proper brisk walk, and you go to about 9,000 steps, that is the recommended activity that anybody should be doing. So normal everyday activities require about 5,000 steps, but you need to add something like 30 minutes every day so that you go up to the level of 9 to 10,000 steps per day, and there you would reach a recommended activity level which will optimize your current physical status. Now if you add another 30 minutes to this and do something like 13,000 steps, you will have to go for a proper brisk walk for about 40 to 50 minutes per day. And that is the ideal level where you will gain certain cardiorespiratory or cardiovascular benefits. So that's about walking. Now, what are the other physical activities that improve aerobic fitness? So basic ones that you do in your everyday life, you could be walking, bicycling. I do encourage people to walk instead of taking out their two-wheelers for short distances, especially. Always take the stairs instead of using lifts. So that is the basic things that you can, continue to do throughout your life, and you don't have to do anything out of the way for that. Of course, hiking, doing cleaning, heavy cleaning work, cleaning out your yard or your house and things like that, they also improve aerobic fitness. Now, other than that, if you want to do a specific exercise, then running, walking, brisk walking, that is. And now Nordic walking is quite popular in Europe, especially. You can see that in the photograph that I've shown here. It basically has these two poles, like skiing poles, and you use your upper arms as well as your lower limbs while walking. So it gives a pretty good all body workout. There is trekking, swimming, rowing, canoeing, any sort of ball games, racket games like badminton, tennis and all. You could play golf, you could do aerobic classes or dancing especially. So whatever type of exercise that basically makes you breathe harder and increase your levels of heart rate, that will always end up improving your aerobic fitness. Now let's go to muscle strength and muscle endurance. So what is the significance of poor muscle strength and endurance on your functional ability? Now, when you are in your working age, so you would say between the ages of 20, 30 to 60, basically, if you have poor muscle strength, then your ability for physically demanding work will reduce. Now, in a day and age like today, you will have maximum people who have opted for the conventional careers like, doctors or, people who had done so work at desks and they're sitting all day long, and therefore they stop doing any sort of physically demanding work. So there is nothing like sports athletes or even farmers who needed to do a lot of physically demanding work. So nowadays in cities, we hardly have any work that demands some strength from you. So automatically your ability to do such things reduce, your will reduce, you become very quickly, and of course your back ailments will increase. In the aging population, this is just one of the different mechanisms which will give you such effects. But if you consider lower extremity or leg strength, if your leg strength reduces, your function, you will not be able to climb stairs, you will not be able to walk short distances, and slowly you will start reducing the ability to move. And of course, the number of falls that you have will increase as well. So therefore, muscle strength and muscle endurance is extremely important. Now, what are the principles of muscle strengthening? We need to increase our muscle mass. We need to also increase the endurance that a muscle is able to continuously for long periods of work. We also need to increase the raw strength and power that a muscle has. Now, this I'm going to talk about principles of muscle strengthening for older persons, right? So, what types of exercises are safe and effective for older people? Please bear in mind that strengthening of muscles can be done at any age. At any age, you can also start strengthening or start resistance exercises in a 90-year-old. So ideally, you must do such type of exercises twice a week. There should be 8 different exercises throughout the whole session. You should be targeting large muscle groups, for example, the extensors of your legs or the flexors of your legs or your back muscles or your abdominals. So target large muscle groups. Each exercise should be done 10 to 15 for 8 to 15 repetitions in one set. Okay, so obviously, if you're supposed to do 15 repetitions of one exercise, it is important that you keep resistance low, or the weight has to be kept low so that a person can perform 12 to 15 repetitions of that exercise. If you do 2 to 3 sets of that many repetitions, then you will see an improved fitness over time. If you do just one set, then you will have a maintenance of the current. So depending on your goal, whether you want to improve the strength, you have to do 2 to 3 sets. But if you want to maintain the current amount of physical function, then you can do only one set. Now, in for periodization longer if required. So for an old person, when you start a new exercise, you're going to give them a little bit of weight for dumbbells, for example, then allow them to use those weights for the next 2 to 3 weeks. Once they are familiar with that, you can slowly increase that. Now, probably as athletes, when you train, especially for physical strength, or you do gymming, then you might have heard of the repetitive maximum method. So it is called the RM method. And in this, you basically you check how much weight can you lift or push in one repetition. So your maximal exertion is required. And based on that load, we then calculate the target intensity for younger people. Now, this may not be a very practical approach for older people, because to get somebody to apply their maximum effort in one repetition is not without its safety issues. So you might have people who get injured just while testing for how much they can press. But if you still want to use this method, then your target intensity for older people should only be about 40 to 60% of 1 RM. I usually personally don't use this method. I will usually like to use the perceived exertion method. So this is what I'll be talking about later on. Please remember that your increase needs to be graded. Your resistance needs to be added only every 2 to 4 weeks. So if a young person has ever been to a gymnasium, you will see that every week you are trying to add weights and do a little more than before. Either repetitions you increase or your weight you increase. But in older people, do that increase every 2 to 4 weeks only. So it has to be very gradual. At the same time, it is important that you do increase that resistance, because only if you overload the muscle, it will gain in strength. So that principle has to be remembered. it is good to utilize the entire range of motion of joints. So don't just work out in the middle range, but go right to the end so that the entire joint is worked out. Always add an element of power training a little bit later on when the techniques are perfected. So power training means you add an element of speed in that training. Always remember the concentric phase, which is where you pull or you push a load, that has to be fast, and the eccentric phase, which is getting back to the original position, is where what you do very slowly. So concentric is to be done fast, and then coming back to the original uh, go position is to be done slowly for older people. Of course, we will be talking about safety considerations in the following slides. Now, what is the rate of perceived exertion scale? So you see this scale over here, and basically you ask somebody what a certain exercise has felt like. So if you ask somebody to take a certain amount of weight and do an exercise for say about 10 to 12 repetitions, at the end of 10 to 12 repetitions, you will ask show this chart and ask this person what that exercise felt like. So maybe somebody has had too much of weight, and then they feel that at the end of 12 repetitions, they cannot perform anymore. So that will be something like 20 or maximal exertion. So we don't want to go in this at this level at all, but somewhere around this yellow box where a person is able to tell you that the exercise has been somewhat hard or hard, but not more than that. Always keep within 12 to 16 in this scale. And for every exercise, you have to continue to ask this person, what did your exercise feel like? If that person remains between this 12 to 16, you know that you're doing the exercise safely and at a good level. So what are the physical activities that can develop muscle strength as well as endurance? So again, I'm paying a lot of emphasis on daily chores, because for older people, if they're working at home, half their exercise or fitness activity is already done. So encourage people to do work around the house. Any housework is good, gardening is great, cleaning up, rowing, cutting wood, climbing stairs, all these things help muscle strength very much. Other than that, people can also do a gymnasium workout, circuit training, you can do functional training, any workouts basically that involve muscle strength. Now let's get to the third aspect of fitness, which is motor control. And the basics that are abilities that involve motor control are balance, coordination, agility, posture, and movement control. So all these aspects need to be looked at when you talk about motor control. Now, as we age, our sensations, our vision, our hearing, our sense of touch, for example, that reduces, and naturally reaction time, the time that is taken for us to react to any kind of stimulus increases. Sorry, that arrow should be pointing upwards. So reaction time should be increasing. You should improve with aging, coordination reduces. Your ranges of motion of your joint also reduces, and your muscle power reduces. So basically resulting in loss of balance, and also there is falls also could increase. Okay, what are the physical activities that develop motor control? So any type of physical activity that is multidimensional, that requires body control, changes of direction from one place to another, they require coordination between the nervous system. So for example, in this picture, you will see a game of volleyball in older people, and the nervous system is working a lot. All the sounds, you have to look at where the ball is, how far it is falling, how quickly you have to react to it, how well you have to coordinate with your team members, your sensations, your muscles have to all work together. So any activity that basically involves all these things will develop motor control. So walking, for instance, why I say cross country walking over here, the reason is simply because you need to have a walking route that involves a lot of ups, downs. There are different surfaces. There might be sand, there might be rock, something to climb over, grass at some point. So if there are different surfaces and therefore cross country, you will have a much better chance of developing motor control, as opposed to somebody who's walking in the same on the same concrete platform every day of his life. So walking in a more dynamic surface. Then you have things like canoeing and skiing and stuff, which we don't do in India. But yes, ball and racket games, very, very good. Dancing, different fitness workouts. There is yoga, tai chi, Pilates workouts. There are people who practice fitness, boxing, etc. And golf is a very, very good way of also developing motor control. Let's talk a little bit about skeletal health. So bone, we've talked about muscles so far. So let's talk a little bit about bones as well. Now, we all know that bone is living and regenerating tissue and adapts to mechanical loads basically, and to the influence of hormones acting on it. So basically, any exercise that you load the bone mechanically, the bone will respond to it. When more tissue is lost, then the mineral content of the bone, the calcium content of the bone reduces, and therefore you will have less bone density and osteoporosis. So if the reduction in bone density is over 30%, then you will have a disease called osteoporosis, where the bone is not strong enough, the calcium deposition is less, and you are much more prone to any sort of fracture. And believe me, in India, maximum people suffer from osteoporosis because we've never thought about how we can maintain our skeletal health. So as the population ages, osteoporosis is a great challenge to public health, because it ensures, basically, if you have an osteoporotic bone and you fall, whether it is on the road or in your bathroom, you will have a fracture. So your brittle spine also leads to a lot of backache issues and postural problems. You see so many older people who are bending with age, and that is nothing but osteoporosis. It is not just age, but basically that their spine has osteoporosis and therefore it has bent forward. Now, what is the role of exercise in strengthening the skeleton? Okay, so as you can see, the blue arrows show that when you are growing, so from birth to up to about 20 to 25 years of age, exercise, if you exercise, I will soon be telling you what type of exercise, but you will be gaining skeletal mass or bone strength. Your the percentage of bone content, mass and density will increase if you're exercising in your up to the age of 20 to 25. After that age, between 20 and 60 or 20 and 50, exercise can preserve or delay the loss of bone. The minute you hit puberty and the age of 20 to 25, everybody starts losing bone density, everybody. But if you are exercising, you're keeping yourself fit, you're keeping your muscles in good shape and condition, then your bone density will be preserved. After the age of 60, the rate at which the bone density reduces and becomes weak uh, increases very quickly. So you can see this thick black line. It suddenly starts to decline after the age of 55. And this process also can be delayed or preserved with exercise. So exercising is extremely important for bone health. Now, what type of exercises should one do? So for preserving your bone strength, you should be doing weights. You should be bearing weight on your body. You can have high impact and high velocity exercise. Sudden changes of direction are very good. And of course, anything that challenges your balance will also be very, very good for your improving your bone strength. Now, when I talk about these attributes, basically, if you do high impact or you are, having this kind of loading on your bones, also when you lift weights, wherever your muscles are pulling on the bone, that is where calcium deposition occurs. And that is how your bones become stronger. So that's why it's important to do specifically exercises that involve heavy working, heavy housework, gardening, brisk walking, jogging, because the impact is good. Any kind of fitness workouts where you do aerobics and you're jumping around, you're dancing, workouts where you use resistance, you're pulling and pushing against weights, ball games which involve, playing with children, changes and speed is it stair climbing. All these are very, very good for your bone strength. This slide basically tells you that bone strength needs to start being built on right from childhood. So in your childhood, if you are jumping, bouncing as often as possible, that is when you accrue that maximal bone mass. Once that period is gone, you cannot get any more bone mass ever again in your life. So when we please think about telling children not to play, telling children not to jump, telling children not to climb different places. So childhood up to the age of puberty and up to the age of 20 years of age, it is extremely important to build your bone bank. So therefore, if your athletes, anybody has told you not to play and study instead, please do not listen to them. When you are older and you're an adult, that is the time when you need to preserve this bone bank that you have built. And that is why you need to do activities that involve speed and power, play racket games, play ball games, run, jog, dance, and so on. When you are already a senior, then pay attention to strength. So work out on your muscle strength and also on your balance specifically. And if you are already an older person who has osteoporosis, then you must pay a little more attention towards preventing falls. But at the same time, it is very important to preserve your physical activity and your good posture. So exercise throughout your life span is important for bone strength. Now, flexibility is just a small part. It is also important to work on flexibility because flexible joints will help you to do your everyday activities much better. It will prevent back pain, for example. Preserving good flexibility in your shoulder joints will allow you to do a lot of upper arm activity, whether it is reaching behind, reaching up. For older people, these are exactly the problems that they start facing when they grow older. Ankles and hips also need to be flexible because your balance control immediately suffers if your joints are stiff, and therefore falls also may occur due to these reasons. Now, what to do to increase flexibility? I'm sure all of you as athletes must be doing your stretching exercises. So regular stretching is very important. Please remember that any stretch to be effective has to be done for over 30 seconds. So just stretching something and leaving it will not stretch out the muscle. Keep that stretch for at least 30 to 45 seconds or even 1 minute if you have the time. Careful stretching before activities requiring speed or great flexibility reduces muscle and tendon injuries as well. So it can also be part of your warm-up. So any cane workouts, home gymnastics, you can do yoga to stretch out. Tai Chi is also wonderful. It's a Chinese method of physical exercise. Dancing, ladies gymnastics, for example, where you do a lot of stretching, are also very good ways to improve your flexibility. Now let me talk quickly about preventing falls. This is a very recent study done by the Cochrane Institute, where they have looked at 159 research trials with almost 80,000 people, and they have checked what are the different ways in which you can prevent falls in older people. So they checked so many things like, improving lighting, or removing furniture which people trip over, giving them good eyeglasses so that vision improves, and so many different interventions were basically tested. So what they found was exercise was basically the single most important method by which falls can be prevented in older people. So supervised group exercise reduced rate of falls by 22%. Um, and basically any type of exercise that involved multiple components were extremely effective. Now, the interesting part over here is exercise not only reduces falls, but even if you fall, you will get less injuries if you are exercising regularly. So 37% reduction for all injuries was seen in people who fell as well. So there seems to be some mechanism by which being fit will allow you to even fall in a more safe manner. So you are able to correct yourself to an extent that you don't actually injure yourself or have a fracture. So this was a study that I personally was involved in. This is my doctoral study, basically where we took 4 groups of 100 women each. We gave them either vitamin D and exercise, only vitamin D, only exercise, or none at all. And we looked at the effect on falls, and of course the effect on muscular strength and fitness as well. So 24 months or 2 years we were training half these people with exercise, and twice a week over 1 year. Plus we gave them home exercises as well. We worked on strength, balance, agility, and mobility training. Please note that these were all women between the age of 70 to 80 years of age. So they all exercised with us for 2 years, and this is what we saw. Effects on muscle strength. On the left, you will see in the left box that the lines in blue and purple were basically the groups that did exercise. So there was almost a 20% increase in muscle strength in the groups that did exercise, compared to no change at all in the green and red ones. On the right side, we took, I'm showing you backwards walking, which is basically indicator for balance. So again, the exercising groups improved significantly over 24 months. And this is not all, but the effects of this exercise, when we looked at the same people after this trial had finished, after 2 years, at the end of 4 years also, there was some exercise effects that we could still see, and the groups were different. So what type of exercises did we do? This is a real picture or taken of my particular exercise group that I used to lead. And these ladies are all between 70 to 80 years of age. You will notice that each one of them is wearing a weight cuff around their ankle. Most of them have a 2 kilo weight cuff in each ankle. So they were able to do this much. And of course, we built it up over 2 years. But balance is wonderful. They're working with weights, and we targeted lower limb strengthening, power, balance, and agility. Our exercise was every time challenging and progressed over a period of time. We paid a lot of attention to safety and compliance. We gave them group-based exercises as well as gave them exercises to do at home. And the exercise had to be often and long-term. So over a period of 2 years and twice a week at least. So multiple benefits were seen: physical fitness improved, functional ability improved, bones became stronger, and of course the sense of well-being and psychological effects also were seen. So coming to psychological effects, it is very well known that physical activity and mental well-being, they go hand in hand. When the body is healthy, the mind is healthy as well. So each one of these has an effect on the other, and therefore physical activity also works in this manner. Now coming to principles of exercise prescription, particularly in older people. In general, I will tell you, you must already know that there are certain principles that exercise involves. One is that it is specific. So specificity is one very important principle, which means that if you exercise a certain thing, you will see benefits in only that one aspect. So for example, if you are going to train your biceps muscle, you will see improvement in your biceps muscle. So it is not going to happen that many people come to us and say, pet kam karna hai, to pet ki exercises batao. So it doesn't happen like that. So whenever you are doing your one type of exercise, it's not going to have an overall effect on the other parts of your body. So if you are strengthening, you will strengthen. If you are doing cardiorespiratory fitness, your endurance will increase. If you are doing weight loss specifically, then your weight loss will happen. It may not necessarily give you good strength. So please remember the principle of specificity. The second most important thing is the overloading principle. So when you put somebody above and beyond his comfort zone, only then you will see a gain in your output. So for example, if somebody is used to walking for 10 minutes every day and goes on walking for 10 minutes every day for the rest of his life, he will not see any improvement in either his diabetes, sugar levels, or his blood pressure, or his strength, or his cardiovascular fitness. So every time you need to come out of this basic what you call comfort zone, where you're trying to do a little more than before, and only then you will progress in your fitness level. The third principle is maintenance. So when you have reached a certain desirable level of fitness, that is when you only have to start doing a maintenance dose. So you do enough exercise just to maintain that level. If you stop exercising at that point, the effects of exercise again will go back to zero. So you need to continue to do your exercise at a maintenance dose. Now, also very important is recovery. So this is very important. I'm sure as athletes, you know that it is important to take rest days and breaks from your exercises so that your muscles and your body is allowed to recover. Also for older people, please consider individual characteristics. So the health status of a person. When an old person comes to us, we first look at their general health status. We have a questionnaire where we look at each and every status of their health. We look at how much physical exercise they're used to doing. We look at any sort of diseases that they might have and what other health issues they might have. So that will be your starting point. Please note that no matter what a person's health status is, you can still start exercising. Of course, a professional needs to understand and tell what exactly has to be done, but there is no bar to any sort of health status or age when it comes to starting exercise. Plus, please take into consideration the skills of that person. So if a person has not been walking and is in a wheelchair for 2 or 3 years, you cannot expect that person to start doing a walking exercise regimen. So therefore, look at the skills Look at what habits people have, what time they get up, what time they are comfortable, what time do they take their medicines, what time do they feel energetic enough to exercise. Also, what their interests are, what is interesting to them, how they combine with their friends to do certain things. Because only when you cultivate an interest in exercise, only then you will find that people will stick to that exercise. Otherwise, very easily people do it for 1 day or 2 days and then stop doing. And then, of course, you must consider what opportunities they might have. For example, whether they have access to a gymnasium or not, whether they have access to a swimming pool or not, whether there is somebody to help them go to that certain place where they want to exercise, and so on. So opportunities are important. Now, why am I telling you about exercises, for principles of exercise prescription for older people? Because I know some of you may be athletes, many of you are going to become trainers later on in life, many of you will become personal trainers, many of you might be fitness consultants. So therefore, it is important that you do understand principles for all age groups, and especially since this is a large age group. Now, this is a busy slide. I'll very quickly tell you that what happens when you start exercising. We start here at the bottom. So from the very first exercise session, you will find that your carbohydrate and lipid metabolism improves. Yeah, your joint mobility also starts improving. Any kind of physical activity that maximizes your energy consumption right from the first session. If you continue to exercise for 2 to 4 weeks, you can see a measurable increase in muscle strength. Again, one step above this, if you continue to do that exercise for 2 months, then you will see that your blood pressure starts coming down. So anybody suffering from a high blood pressure will see a definite change in their blood pressure levels. Your heart rate also starts reducing. Now, as athletes, you might know that all the best athletes in the world will have lower heart rates, resting heart rates. That is because their heart can function more efficiently than other people. So a lot of tennis players, for example, Bjorn Borg comes to mind, that he was a player in my time. So he had a resting heart rate of 52 beats per second, which really showed how well his heart could perform. So resting heart rate starts reducing. Then in 3 months, you will actually show a good increase in your cardiorespiratory fitness, which can be measured with a stress test. So 3 months of exercise can show you a definite change in your stress test. 3 to 6 months, you will see good HDLs and cholesterol levels will improve. In 1 year, you will see an improvement in bone strength, and of course, your weight will have gone down by this time. And in general, if you continue to do a regular physical activity and exercise, your risk for cardiovascular diseases and diabetes will reduce. So what are the physical recommendations for older people? So many people ask कि ठीक है exercise करना है, अब तो समझ गए, लेकिन करना क्या है और कितना? So basically, these are the latest recommendations given by ACSM, or the American College of Sports Medicine, and of course a lot of other institutions in Europe also. They are now saying that we start from the bottom of the pyramid to the upper level. So they are now saying that it is very important to get as much of sleep as you need. So when you're talking about physical activity recommendations, it's really amazing that they're now starting to talk about sleep first. So basically, sleep as much as you require. Above that, you need to take breaks from sitting whenever possible. So now, in a day and age where people are sitting so much, it becomes even more important that you get up from sitting as often as possible. Above this, the next level of importance is light physical activity. So you are working around, you're walking, you're doing your everyday work, you're going to the shop, you're doing your household activities. So any activity that requires slight movement, you need to do as often as possible. So this category also involves exactly those where अभी ब्रेड लेकर आना है तो टू व्हीलर पे बैठ के चले गए 5 मिनट दूर की दुकान तक और वापस टू व्हीलर पे आए. So no, so this is an opportunity to do that light physical activity, walk there for 5 minutes, walk back. So this is to be done as often as possible. Apart from this, now we come to the real exercise part, where a person needs to be doing moderate level exercise where slight increase in heart rate and breathing rate happens, at least 2 hours 30 minutes per week. Now this may seem very little to you because you're athletes, but please understand that maximum janta in our country and around the world don't even fulfill this much of criteria. They don't even exercise for 30 minutes in a day. So 2 hours 30 minutes per week has to be done of moderate intensity. But if you're doing high intensity workout, then you can do 1 hour 15 minutes per week. Apart from all this, you need to do muscle strength, balance, and flexibility exercises at least 2 times a week. And the general idea is to try varied combinations of all these activities within the week. So challenge your muscle strength, power, motor control, and flexibility all at once. Now, when you prescribe exercise for older adults, please keep in mind that there are changes happening in motor control in older people. So allow more time to plan and execute tasks. Don't give very complicated tasks and give enough time to get the technique right, to learn new movements. Understand that there may be changes in cognition, which means there may be changes in perception. They may not be able to hear you properly, see you properly. There may be problems with concentration, thinking, memory. Short-term memory will weaken. So many times you might feel कि अरे पिछली बार ही तो ये exercise बताया था, अब फिर पता नहीं कैसे करना है. So no, every time you will have to patiently tell what done. And of course, multitasking becomes difficult. So you cannot tell somebody कि ये भी करो और साथ में वो भी करो. So it has to be broken down into smaller things. Exercises should be familiar patterns or into simpler tasks. Of course, please consider the health status in condition that is to take into account any pain that may be there, because older person, when it comes to you for exercise, always somewhere or the other, there may be day to day. आज बहुत पेन था, कल अच्छा है, परसों फिर प्रॉब्लम हो गई. So every day is different and exercise needs to be planned. Plan your starting positions, transitions, and exercise sequences carefully. So for example, many times we have interns and students over here, and then they basically have some idea कि ये exercises they don't plan the positions and transitions for that person. तो पहले आप लेटा दो, उसके बाद लेट के 2 एक्सरसाइज किए, फिर इमीडिएटली बोलो अब उठ के बैठ जाओ, फिर यहाँ एक किया, फिर लेट जाओ, stretches भूल गए थे तो stretches late. Don't do such things. You need to understand that it is difficult for an old person to make transitions and to change positions quickly. So plan your sequences nicely. Start with a certain posture in standing, for example, then go to sitting, then go to kneeling, then go to a lying down position. So plan this in your mind carefully. Don't do over the shoulder level arm exercises for a prolonged period of time, because that puts a lot of load on the respiratory and heart. So these systems. So therefore you can do, but not for long periods of time. So you can give breaks between different upper arm exercises. Encourage dynamic movement. So think about, things like changes of direction, stepping techniques, forward, backward, sideways. So dynamic movements, and of course good breathing techniques need to be incorporated so that nobody is holding their breath while doing any exercise. Tailor every exercise according to the individual needs. So for a person has knee pain, they do need to do squats, but it has to be tailored so that that person doesn't feel the pain while strengthening the lower legs. Also consider their psychological needs, understand each person's strengths and achievement, allow them to make their own decisions, what they want to do, what they are liking to do, and what their own goals are. So many people might come and say कि मुझे अपने friends के साथ mall में घूमना है. So that is a goal for that person. So they understand you need enough endurance to walk from one end to another. You need to have good balance to get on the escalator. So your goal setting has to be accordingly. Explain the role of each exercise. Tell what each exercise is doing for that person instead of just mechanically telling them to do that exercise. And last but not the least, please ensure that the person has adequate nutrition and hydration, of course with emphasis on protein intake, especially for older persons. Now I always say that while I understand something about nutrition, I have read a lot about nutrition, but all the same I am not an expert, so it is always better to refer to a correct nutritionist to do the needful. Of course, any injuries need to also, as Dr. Ganveer mentioned before us, any injuries need to be looked at by a proper professional or a doctor to see if they are serious or what can be done about the injury. What I am basically telling you, principles are to avoid the injuries in the first place. So, individually tailored, have a combination of aerobic resistance and balance training, target large muscle groups, include a proper warm up for 10 to 15 minutes, do the main session, and then have a stretching and flexibility session or a cool down period for another 10 to 15 minutes minimum with an old person. Monitor intensity, type of exercise every day, always with progression, so that the person also sees some gain in their physical fitness. Think about feasibility, whether that person can come to your gym or cannot come, whether this exercise is going to help in their day-to-day life, whether functionality is going to improve. So for people who, for example, are very low in their physical fitness, you will pay more attention to functionality. So that person should be able to, for example, go to the bathroom himself. So for that, what will you strengthen, what will you teach, and so on. And of course, a pre-screening or an assessment, preferably by a doctor. If you can do a stress test, do it. If that person cannot undergo a stress test, you can do different tools like the 6-minute walk test and so on, so that you have some basic idea about the pre-exercise health status. Always it is the good time to start, no matter what your health status is or what your age is. And please remember, if a person has never exercised before and doesn't have good fitness, that is exactly the person you will see the maximum gains in. So you encourage somebody to start exercising, you will see results much more quickly. Even a small amount of regular exercise is good. Start exercising in moderation and gradually increase walk everybody. It's just that you need to understand what the speed should be, how much to do, what surface to do, and so on. And remember that exercise goals will change with age. So let that person tell you what their goals are, work accordingly. So now, although we may not want to do this when we are old, but yes, we might like to do this, and we certainly want to be able to enjoy our family. We want to be able to do our everyday things. So therefore, exercise, keeping fit, having good diet is very, very important. We all are going to grow old. We don't know now what kind of living arrangements we are going to have, whether our children are going to be living with us and helping us out. So the level of independence needs to remain high until the very end, so that we have a good quality of life. And therefore it is important to maintain physical fitness in older people. To do exactly this, we have a really nice multidisciplinary geriatric program at Jahangir Hospital, where I work with the neuropsychologist, and we take care of the cognitive stimulation as well as maintaining physical function parts both together. So it is all based on WHO guidelines. We look at enhancing day-to-day experience and improving quality of life and enhance the functional ability of elderly people. These are some really nice pictures of that group, and which we continue to run even now. So people basically having a good time as well as exercising and doing mental activities as well. So these are the resources that I have used for this talk, and I thank you very much for your attention. And if there are any questions, I'll be happy to take them now.
Yes, thank you, Radhika madam. In very simple and sweet language, you have given lots of information regarding the geriatric fitness and how to take care of that. We will start with the question sessions. If the participants have any question, please put it in the chat box. Before that, some questions are there.
Yes, I can see one question. Does amenorrhea in female adolescent athletes affect skeletal strength? So, see, there are a couple of aspects to this. So, if you talk about amenorrhea, whether it is pathological, whether a doctor has seen it, or it is just physiological, where due to a lot of physical how do you say physical activity, a female doesn't get her menses, then in that case the menses are just delayed. It will not affect skeletal strength. In fact, it will increase the window period in which you can gain your muscle mass. So in females specifically, until the time menses start, bone strength keeps on happening. Once the menses or menstruation has started, after that, from menorrhea onwards, the gain in muscle, in bone strength basically slows down and eventually stops. So if there is a person or a female athlete who has delayed menarche, then in that case, I would not worry. But if the amenorrhea is pathological and that person needs to really see a doctor and then have a look at different endocrine functions, because it involves also your thyroid functions. It will involve a lot other things which will ultimately affect skeletal strength. So it is important that a doctor looks at this condition.
Yes. Next question.
So I guess everybody
Prabhu sir is
has
going to ask one question.
well
Yes.
understood.
Yes, yes, sir. Prabhu sir is asking one question.
Yes.
Prabhu sir.
Yes, sir. Hello, ma'am. There is a
Yes.
question like, can a person help himself or herself if he or he starts trying to be healthy at the age of 40 to 50 years?
Sorry, can you please repeat?
Yes, ma'am. Can a person help himself or herself if he or she starts trying to be healthy at the age of 40 to 50 years? So he's not
Yes,
doing any activity before that and he starts at 40 or at the age of 50. What do you would prescribe?
Yes. So basically the safest and easiest way is to start walking. Slowly can progress to brisk walking. For this, you will probably not need any guidance. But then if a person wants to start gymming or wants to start a particular type of exercise at the age of 40 or 50, I would definitely recommend that at least 1 or 2 sessions are taken with a professional, so that the safety aspect is are taken care of. In a lot of such cases where people at the age of 40, 45, 50, they present with, diabetes, overweight, and cardiac issues, then they are told by their doctor कि अभी exercise करना important है, तो शुरू करो, lifestyle बदलो. So इस in this phase, then it is a little bit more risky to start off on your own, especially things that will tax your heart and your cardiorespiratory system. So in that case, a professional guidance will definitely help out. Once you learn the principles in 2 or 3 sessions, then you can slowly start going on your own. And believe me, a good professional is never going to tell you to continuously come to them. That person is going to ensure that you understand the basics, and then maybe come for a follow up after every few weeks or something like that. So definitely it helps to have good guidance. It is very easy to see YouTube videos and copy them, but then one does not know whether it is suitable for oneself, especially if you're just starting after after half your life is over. So it is always good to take professional advice, but then simple things like walking, stair climbing can be done by everybody. There's no issues with that at all.
Ma'am,
Ma'am,
related
I
to the
have a
same, yes. Usually what tends to do is an old age person who is already working out for since like 10-15 years, he wants to exert himself more than expected. So what would you suggest for them?
So for them to build their fitness, as I said, a person at any age can build fitness. So a professional ideally should help you to set a goal. So if that person says, मुझे थकान आती है, या मैं ये चीज नहीं कर पाता हूँ, so that is the time when that person, when that professional should identify what issues are there and start working on that. So muscle strength, definitely there are so many studies which have shown that in older persons also muscle strength really increases by doing strengthening exercises. It is just that you have to see whether it is done safely or not. Definitely anybody can start at any level and at any age. So work on strengthening lower limb strength, as I said, very important to keep functionally active and also to prevent falls. Work little bit on upper arms also, so that everyday activities become easier, and work on balance. So balance exercises that people never do, never think of doing. So therefore, it is important to do these things.
Yes, ma'am. Our Kumar sir is asking one question. Core muscles become weaker at older age. While conducting core workout, is there any chances of hernia for older people?
Okay, so hernias basically occur when you are not using your core muscles. Okay, hernia happens when you don't use your core muscles and your core muscles are weak. So an optimal exercise regimen should start with a gradual core strengthening and come up to a high level of core strengthening. So therefore, actually doing core exercises will always prevent a hernia, not actually cause it. So when people with bad abdominal muscles try to push something, that is when you will make your hernia worse. But if you are doing your core muscle exercises, that will never cause a hernia. It has to be done in the right technique. That is all.
Yes, I hope the confusion is clear, Kumar sir. Ma'am, at what age the person start losing muscle strength and bone density, or his bone is weaker? At what age starts?
Okay, so I would say around the age of 25 is where you reach your peak muscle and bone strength, and from there onwards decline slowly starts. Then that is the point where you have to think how much you have kept your fitness up. If you are a sedentary worker, working at the computer, never doing any exercise, then your bone and muscle strength both are going to start declining from the age of 30 onwards. So basically, that is what happens. The difference only occurs in people who keep fit and don't keep fit.
Yes, ma'am. Yes. Suppose a person, a middle-aged person. What is the difference between the middle-aged person and older person regarding the physical fitness or bone strength, muscular strength, cardio strength? What will be the major difference? and how to handle the difference?
Okay, the major difference, basically I showed you that there are different changes that have already occurred in the body because of aging. So there is a certain capacity that your heart and your muscles can take. There is a certain capacity that your muscles can take. There's a certain capacity that your bones can take. So therefore it is your overall state of fitness is lower than than the same person if he were at in adulthood or in working age life. So if you see the trajectory of that same person, he will be stronger, will have more fitness and endurance when he is younger as compared to when he is older. But that being said, there is so much difference between older people of the same age. There is so much difference that 65 be running a marathon, and some 65-year-old will be bedridden. So there is a lot of difference, again depending on what your lifestyle has been and what your genetic predisposition is. So I would say that you should compare with yourself always what you were during your lifetime. So your goals should be similar and never to compare with another person. So ideally compare with okay, you have this at some point, and make this goal to have at least 60, 70, 80% of that what you used to be when you are older.
Yes, ma'am. This was the answer.
I hope that answers your question.
Yes. Even the next question, the Andrea has given. Andrea is put in the chat box.
Yes, when out and playing, always active from childhood, stops due to work, person be more prone to sickness or is slow. As you said, most of the strength and muscle develops in childhood itself. So yes, when a person is working out and playing and active from childhood, suddenly stops. So due to work, I would assume that you're saying you get a job. So your age will be somewhere in your 20s, 20, 22 years of age, and you suddenly stop playing and being active. You will not be any slower or any sicker than any other person who is sedentary at that age. Okay, so many people say कि अभी exercise हमको नहीं करना क्योंकि बाद में weight gain हो जाएगा. So I find that actually really ridiculous, because being active, playing is something that you have built in your bank. It will never pull you down. It will always be a place where you can build from. Okay, so at any point in your life, if you are able to be active and play, you should do that. Never ever can you say that because you exercised and then stopped, you are worse than before. That is never ever going to happen. So anytime you are active and you have played, it will always be a plus point, because later on, even after a certain gap, you will be able to remember your techniques. You will be able to remember how your body and your cells, your muscle cells, your brain cells have some sort of memory to pick up, and you will be able to come back faster. Okay, so compared to a person who's always been sedentary, you're always going to be better. Okay.
Yes, ma'am. I hope all the queries of our participants are answered. Thank you very much, ma'am.
Thank you.
I don't think so. There are any more questions. Over to Andrea, please.
Yeah, just one important thing. She asked that whether the person must start working out from basic again due to the sudden stop. Yes, you must start from the base, but I can assure you probably a lot faster. Okay, so start from the basic and increase gradually, and the progress will be faster than before. So I think that's the last question.
Yes.
Thank you, ma'am. I would like to thank you, Dr. Radhika Patal, for your time, knowledge, and imparted. imparted on physical challenges associated with aging, the health issues faced by older people, the challenges like your muscles, your metabolism, you spoke about your balance and mobility, the capacity of the person as it reduces. But if you are in a continuous workout, you would still be able to do certain activities that fit and more health. Also, the behavior of health maintenance like workout, diet, the genetic and all plays a very vital role in our health and for our older age. This was something that I really learned from your session. And also, I also want to know is, I also want to thank you for telling
I think Andrea has some network issues. Am I audible? Yeah, Kumar, can you
Thank
hear
you
me?
for the opportunity to speak here. Thank you, Dr. Shrikant. And I'm looking forward to sessions as well.
Yes, ma'am. Yes, ma'am. Thank you very much. Thank you. Me that.